it's officially 12 o'clock, which means it's the start of our first ever Women in Leadership Conference of 2024 with the IHSCM Women in Leadership Special Interest Group. I'm Jade Maloney. I'm Operations Manager here at the Institute, and it's my pleasure to host today's event. Thank you for the excitement, everybody who joins us in the audience today. For those of you in catch up, I can see you cheering as well. So for our first session today, we are having a slight change because the fabulous Sue Henry, who is co-chair of this group, has got a very sore throat, so we're letting her save her voice for later on for some contributions, and we will be hearing from her later on in the year around the Women in Leadership podcast, which will be launching on the 2nd of April. So instead, we'll hear from Dr Claire Mould, who was going to interview Sue and find out around her inspirations, what drew her to the sector, and how she can help inspire you. For session 2 today, we'll have a masterclass with Jackie McBurney on empowering menopause through workplace support. She was the founder of the NHS Menopause Network. Session 3 will be a roundtable on how to build resiliency in the workplace and finding your tribe. We've got several panelists who you'll hear from later today. And finally, we'll hear from Maggie Helliwell, who is a retired GP, and based on her experience, what it was like then versus now for women in leadership. So we've come a long way. We hope you enjoy today's session. Without further ado, I'm going to bring in Dr. Claire Mould so we can hear from her. So Claire is a fellow of the Institute, which recognises her contributions to such events as today, supporting activities, and she's also a co-chair of the Women in Leadership Special Interest Group. Now, Claire is director of Curve Strategic, a company that she founded, and she'll tell us more about shortly. And she's also recently become CEO of the Heart of Mencap England, which is fantastic to hear. Now, Claire's experiences have shaped who she is today and how she leads. The opportunities she's had has driven her into her roles, and she's built strong relationships, but she's also had some setbacks. So let's hear how Claire's story resonates with us and inspires us to be better women in leadership. So Claire, tell us a little bit about your life. What were some key life moments that helped shape who you are today?
Right, hi, and good afternoon, and thank you so much for everybody joining in for today. I'm really, really pleased to be part of the inaugural Women in Leadership Conference. So I suppose some headline points, just sort of a little bit of background. So I was brought up in Cornwall, so very rural background, very sort of, small, sort of right by the coast, grew up sort of quite idyllic in that regard. And I suppose even from then, I kind of realised that as lovely as this was, that it was just a small kind of glimpse of what was going on in the world, and that there was sort of like more to the world beyond that. So it was a lovely place to go and to grow up in, but there was more to that, and I was very aware that we were protected from the vulnerabilities from people with disabilities so much, and multicultural side of things, because you just saw the group of people that you mixed with and you knew. So even from a child, we sort of moved up, and so I suppose from the onset there I had a sense of, actually I want to sort of do more. I had a sense of how fortunate I was from the early doors, and then wanting to support other individuals, moving forward as we go on, because you begin to see things that are going on in television around the world, and you think, actually, I'm really, really cosseted. And then I think that drove me, probably subconsciously at that point, to think, actually, I'd like to do something that enables me to contribute in some way, and draw on the fact that I'm very lucky to help those people that aren't as fortunate as I am. So that was the first thing that I sort of thought when I was growing up in Cornwall. And so that was very idyllic, and then went on to university, and then because of careers, because as I quite like the idea of helping people, the careers teacher said that, actually being a teacher or being a nurse would be sort of the two main things that you could either go towards. And so I thought, teaching would be quite good of the two of those. And I'll tell you why. Primarily because my mum was a nurse, and I thought, well, she was a nurse, so I don't want to look as if I'm just copying her. I'll go and do something different instead. So I trained to be a teacher, and I'll be brutally honest, one of the things that really then frustrated me was I started training to teach in 1988, and that was the same year that the national curriculum was introduced, which was really quite key, because I thought, oh, it'd be really, really great. I'm really fascinated with how people learn, how people develop. And just within this group here, I actually spent 4 years learning how to deliver the national curriculum. And I was a little bit grumpy about that, because I just sort of thought, no, this is what I did, I still want to go into teaching, but I thought I didn't think this is what it'd be like. I didn't think it'd be just all about putting lessons plans together on teaching you how to do the national curriculum. But it was what it was, and I enjoyed my teaching practices and things. And then I fast forward, and then because as I'd wanted to move out of that Cornish background that I'd come from, I got my first teaching job right in the middle of Leicester. So if you want to go from complete sort of difference, that was it. So went in to the middle of Leicester and really enjoyed that, but still found that challenge of thinking, I'm just delivering the national curriculum here, and I want to know more. And I had this sense of, how can we know that, if you took your car into the garage and you were and somebody said, without even opening the bonnet, oh, well, it's 4 years old, it does this, so this must be the issue. You'd say, well, hold on a minute, you haven't even looked under the bonnet. And I got that sense of, I don't even really know about neurology. I don't know about those things. So maybe I ought to go and do a master's in it. And then I will say, as luck would have it, but as the challenges that happen, I was actually involved in a really serious car incident, which quite literally took me out of teaching, and I was told that I wouldn't be able to go, because of my physicality and the way, because it had affected all of my spine, I wouldn't be able to return for at least 2 years. And I just thought, oh, gee whiz, what am I going to do? And then what I'd was thinking, well, maybe this is a good opportunity to do my master's while I'm off, because my brain's still fine. And then I saw an advert for a research student, and I wasn't really altogether sure what a research student was at that stage, but I thought, well, that sounds really good. And it was looking at neurology and early learning, and I think, I'm not really quite sure still now what the impetus was, but for some reason I just thought, oh, well, this is something I feel really, really passionate about. So I applied for it, and it turns out, and I was very successful, and actually I got the research studentship, which meant that I could enable me to go on to do my PhD and focus on it. I later found out that I was the only one out of 350 applicants that actually didn't have a master's, and they were so intrigued as to why this person had applied without a master's, that what it was about them that went. And so that then led me on to get my PhD in neurology. And I never did go back to teaching, but it set then the ground of realizing, in my specialism is between links between emotional intelligence and cognitive intelligence. And so we moved on, and then that enabled me then to be senior research fellow and begin to work more with communities. And I was doing that then. I was sort of studying, my PhD was linking with London and Coventry and Birmingham, so very much inner city stuff and working. And I realized then that what I wanted to do was working in health and social care, using that impetus that I had still when I was a child growing up in Cornwall, but now linking that with my neurological understanding to support individuals that are vulnerable and making some small contribution in any way that I can. And really, even though I've done many and varied things, so after being I went on to be senior research fellow in university, and then I got a little bit exhausted, because the higher up you go in the university towards sort of professorial side, the more removed you get from it. And I was doing lots of publications and writing lots of papers and doing lots of keynotes. I'm very fortunate at the time there was funding available to travel internationally, and I worked in I worked in Kuala Lumpur University and Helsinki University and lots of different universities internationally. And actually was at Thessaloniki University when I completed my PhD. So I was very fortunate in that regard. but I lost sense of I want to get back to the people again. So that's when I set up my first company that I set up, just supporting and working with individuals in the community to repackage qualifications to enable them to be accessible to everybody, because it's at a time that you couldn't go into, they were just introducing, you couldn't go into social work unless you had a degree. And I was working with lots of people because I was chair of a community project in the middle of Birmingham at that time. And a lot of the women, predominantly women that I was working with, who were brilliant social workers, were really good, but they didn't have degree level qualifications, and they would have had to have retrained to enable them to keep their jobs. And I thought that's really unfair. And the reason that they weren't going to university wasn't because they were didn't have the right intelligence. It's because actually, from a gatekeeping perspective, they didn't quite fit in. The terminology wasn't suitable for them. So what I did was I worked with universities. So because as I'd been involved in getting lots of degrees right up to sort of doctoral level, I was presenting them, writing them, getting them validated. I just knew that if, as long as I had the core things, I just rewrote them in an accessible way and delivered. And that was the premise of my company, really. And that really took off. And so I went on to do that and delivered, with individuals, really going right back to the communities, supporting those individuals. And it was really nice. And I ran that company for 10 years. And one of the nice things was 3 of the individuals who were the individual women that I'd worked with in Birmingham, who went on to work with me in the company, because I wanted people that were delivering the programs to have come through the courses, asked whether they could take over the company, because at this time I had 2 children, was living in Cornwall, and ironically got to the point where I was before. I was being asked to write books and do keynotes talking about what I did with the company, and so I handed it over to them, and then went on just cantering, because I'm conscious and I could just talk forever. And I thought this is a good time to hand it over to be a CEO of and I went on to be CEO of a homeless charity, so supporting homeless 16 to 18-year-olds. And then I was really interested with homelessness and people that are discharged from prison, released from prison, discharged from hospital, that also have complex mental health needs and learning disabilities and physical disabilities. So then I went on to be CEO of a charity right across the Southwest that provide housing specifically for individuals that have complex needs, however they may present themselves. So, which now then led me on and then I ended up supporting lots of charities with regard to that. So I thought actually that was a good opportunity for me to step back from that, because I'd set that up to then run my own company, just going into lots of different charities and supporting them. And the reason that I'm now working, in addition to my company, working as CEO of Heart of England Main Cap, is because they asked me to support from an interim perspective to begin with, and then work with them. And then they asked me whether I'd carry on permanently. And there's lots of things I'm really enjoying getting my teeth into. And I've sort of taken that on as what I've done, because it actually fits in exactly with the golden thread of where my career, completely unplanned, but has ended up sort of following a particular trajectory.
It's clear that opportunities have been instrumental in where you are today, Claire, and the support that you've given to others. But what support have you had that was part of being your tribe that helped you? You've got your children, you've got your family. Who else has helped you throughout your journey that you could see as your inspirations that maybe put you on that particular trajectory? Or maybe it's somebody that you worked with that sort of gave you that push along to see the qualities in you maybe that hadn't quite been surfaced that you should see yourself?
Yeah, thank you. I mean, that's a good question. And I would say predominantly, yes, I'm very lucky that I've got a supportive family and children, but have they been instrumental professionally? No, I think, to be honest with you, I'm not altogether sure that they're clear about exactly what I do, apart from the fact I'm not there very often, and they get dragged along to do things like homeless sleep outs and occasionally and fundraisers and stuff. Apart from that, I'm not altogether sure they've ever read anything that I've written or heard anything that I've done or know where I am. So I don't think they've been a professional inspiration. They've been a really good foundation and given me a support. I think it is one of the most, there's a couple of, to use Charles Handy's phrase, golden nuggets of people that, and they have all been completely coincidentally, but they have been strong women that have gone in and done something in spite of potentially where their career path might have taken them. And one of them was somebody who ended up being my sort of, year tutor, sort of mentor person when I first went to university. And she was a phenomenal woman called Eva Ross. And she, and the reason that I loved, talking to her, because her family had fled during the war. Some of her family she was Jewish, and some of her family had been in concentration camps. And yet she bore no bitterness at all. She saw that as actually how much she'd learned, and she was just so inspirational that in spite of everything that she'd been through personally, she saw that she was blessed with an opportunity, that she had escaped from that, so really wanted to give back to other people. And it made me thinking, my sort of saccharine, oh well, I've had a lovely life being brought up in Cornwall, I want to give a little bit back, sort of kind of put that into perspective a bit. And she was really just an absolute inspiration. And I used to like her at sort of, our sort of symposium sessions at university and things, just because she just so naturally put everybody else ahead of herself, and she'd support somebody in such a natural, nurturing way. And I just think, gosh, how wonderful to put other people ahead. And she was very instrumental, because when I applied to do my research studentship, you had to put down a referee, an academic referee, and I wasn't really sure who to put down because I didn't have a master's or anything at that time. And so I asked her, and it turns out that she'd given me a really, really good glowing reference, which had enabled me to get an interview for it in the first place. So she was really, really good. And then there's somebody else who was, again, someone very similar, was somebody who's called Jennifer Joseph, who I used to work with when I first started presenting, when I was doing my PhD, and we travelled internationally to present. And I'd never really presented before, because you grow up in Cornwall, you go to university, you teach, and then you have a car accident and find yourself doing a PhD. I'd never really presented before, but she'd be just so supportive. And I remember one time we were going on to, it was the very first time actually I'd ever done it, and she turned around to me, and I thought, oh well, at least Jennifer's here, she'll be really good. And then we were just about to walk onto this keynote, and she turned around to me and she said, well, I'm going to let you lead this, Claire, because you know far more about this than I do. This was a woman, I should contextualize, who was in her 80s, was phenomenally academic, had done lots and lots of things, had really, really fought to go to university when she was younger, battled and battled and battled. And then she turned around to me and said, oh, and we know, you know more about this than I do. And I went, I really don't, Jennifer. And she said, no, you do, but this is what your PhD's on. You go, I'll be there to support you. And I thought, well, I've got two choices here. So I went on, and she was just so nurturing and supportive, but so giving. She used her expertise and experience in a way to really help me develop. She wasn't a role model as in, look how brilliant I am. Oh, I wish I could be like you. She used her skill to really subtly nurture me and give me the confidence. And so again, I really use that as an inspiration, because then when I'd been doing it a few years and I ended up having new people, I always try to do exactly the same. And it's really good. And I think we see more individuals do that in profession. Rather than bringing the ladder up behind you, you actually throw the rope down and you support people up.
I think that's a key takeaway that you've just said there, Claire, is that we are, as this special interest group is, we are very much a supportive environment, and that is what we are here to do. We are here to create those opportunities, provide that support. And it's clear that anything that is thrown your way, that you set your mind to, that you can overcome. And I just wonder, have you got a current work or goal in life that you're aspiring to right now?
Well, it won't surprise me. You know me, Jade. Yeah, yes, it is. Yeah. I've got themes that I want to do, and not particularly because I end up just sort of, I go and I follow where opportunities are. Though actually, I always have that, like, nothing in my life is a complete coincidence, but you go where opportunities are. But my main goal, I think, that I'm really trying hard to do, and I'm meeting a few people next week about this, particularly working in health and social care with individuals with complex mental health needs and learning disabilities. I think from an inclusivity in the workplace perspective, I still think there's a way we can go to support individuals to just be members of the workplace. I work with a lot of people who are on the spectrum, and still businesses, the ways in which they just colour, you'll notice the sort of like the quite kind of neutral colours behind me. That isn't, again, nothing I do is a coincidence. And we've got to the point in the workplace, I think, the way that buildings are painted, the way that workstations are set up, the way that interviews are carried out, the way that jobs are advertised, where they're advertised, the way we position our staff. I think that there's a whole raft of the community that really would like to be more present in the workplace and have an awful lot to give. And if we are genuinely going to be as inclusive as we need to be, I think rather than seeing it as if we're doing tokenistic gestures, we need to rethink how we advertise things, how we extend our inclusivity to be, rather than being tokenistic, or, oh, actually, we've ticked this box with regard to we've met all the areas that actually we are. So that's something that I'm trying to do. So at the moment, one of the pieces, and I'm meeting with a Lord Lieutenant, as it goes, just next week, because he's quite good and he's working with lots of businesses, and he was saying to me about, oh, well, we're looking to see how charities can help businesses, and I think he was rather expecting me to say, oh, brilliant, I want as much money as possible, which of course I do. But I said, actually, but I don't want to have that conversation with business. I want to talk to them about saying, what are you doing in your workplace to make sure, beyond the disabled toilets, to make sure beyond, hearing loops and everything, what are you genuinely doing in your workplace and your recruitment to make sure that you are opening? Because I think that businesses are missing out, because spending a lot of time, people with complex mental health needs and learning disabilities, they have an awful lot, and physical disabilities have an awful lot to give, and actually putting people on, on particular benefits and actually not enabling them to work, I actually don't think is beneficial for society as a whole. And actually, the individuals who want to make their own valued contribution, they want their voices to be heard, not just, like I say, in a tokenistic, oh, this is a user-led session, but in a actual, I just want to be part of the workforce. So that's just one of the things that I'm thinking of at the moment.
Well, part of being an inclusive practice as well is incorporating well-being initiatives, because being motivated at work has a positive mental attitude. In terms of your well-being and your pursuit, how do you deal with your well-being so that you don't risk burnout? Because you do a lot, Claire.
Yeah, I think, yeah, I mean, obviously, it won't surprise you that somebody who's PhD is in the links between emotional intelligence and cognitive intelligence. I feel passionately about well-being, as you know, and Jade, you glimpsed that. Well, surprisingly, even though it is about to help me with my burnout, but the way that I deal with it is actually through running. And I always say to people, I don't run for the physicality, I run from a mental health perspective. And that is the one thing that my husband does sort of always say to me. He says, I really, really rue the day if ever you, break a leg, because you would be absolutely awful to live with. There are times when I come back after particularly challenging meetings that before I've got through the door, he just hands a pair of trainers to me and go, you might want to go and run off. So I go and have a run, and I just try to do that. I try to do that to, raise any funds for any appropriate charities. But it is it is a very selfish thing, because it is that time for me that I'm not checking emails, I'm not on my phone. The reason I do that is because basically I'm not a good enough runner to be on my phone and run. I'm concentrating on breathing. And whilst I sort of can work things through, I can't think of any high level problematic things because I'm concentrating on my next step and not falling over. And so, yeah, so I do run, and because of that I have found myself doing a variety of things. So during COVID it was quite funny, and they just because I am conscious of time, but and people will sort of say about how, you know, what I was finding is the best way is, well, I thought, well, there's either two ways I can cope with this, because I was obviously, well, not obviously, but I was working 7 days a week, you know, in social care. The charity I was running, we ran 24 hours, 7 days a week. So I was there with them, and I thought I can either have a gin and tonic in between any sessions that I have, or just go for a run. And I thought, well, as much as one might be more tempting than the other, I'll stick with the running. And I just found that what I'd find is on a Saturday morning, that was the one, I had a lull period when all the safeguardings and the issues from Friday night and all the hospital discharges and the not letting people come out from hospital and all that was sorted by late Friday night. And before they all started again on Saturday morning, I used to be able to go for a run. And then what I did, I gradually found this was nice, and I spread it out and I spread it out and I spread it out until one time I just ran for ages. And actually that led me to a fundraising initiative that I did over COVID, that I ended up running an ultra marathon. So I got to the point of, I actually ran 50 miles. So I did a 30 mile, a 40 mile and a 50 mile. And people might think, oh yes, well, that's impressive from a running perspective. But actually that is the thing that got me through running a social care charity during COVID. I haven't run 50 miles since then. I'm running a marathon on Sunday, but that's because I'm doing it for a friend who lost her son to suicide, and it would be his birthday on Sunday. So I'm not doing that. So I hope that the world is never in a position again that leads me to be so stressed that I get to the point of having to run an ultra marathon like COVID. But who knows what the future may bring.
Thank you so much, Claire. And just to come to the end of the very first recording of our Women in Leadership podcast, what is your one key takeaway message that you want to leave listeners and attendees of today's conference with?
I think my one key message is that, and this is something that if anybody's ever been to anything that I've spoken at or anything will really know, is always when you're going out, actually seek to understand rather than be understood. When we come to formats like that, always come to it no matter where you are on the billing, what you're doing, where you're positioning, who you're talking to, the reason for going in for a meeting. Go into that seeking to understand, because the reason I love doing work with the IHSCM and being involved particularly with this Women in Leadership is that I have learned so much, because there's actually just listening to what everybody's got to say and going in, and I've listened to that. So this is again why I feel passionate about working with people with complex needs, because if you actually don't make, you know, preconceived ideas about what you're going into and actually just listen, you realize that you can learn, and the more you learn, the more you can go in. So I just think, just let's genuinely listen a little bit, and just when you're interacting with people, seek to, I mean, it's Stephen Covey said it. I mean, I didn't come up with it. I mean, I've stolen it from Stephen Covey, but I say that in complete, you know, testament to him, that, you know, so that's the one thing that I would share that I live by. Just try and do that a little bit more. Seek to understand rather than be understood, and we'll all be better as a result of that.